Do you sometimes feel your heart beating faster, or notice a pounding pulse for no clear reason? You might be wondering why that happens. One rare reason is a condition called Glucocorticoid-Remediable Aldosteronism, GRA. In GRA, the body makes too much of a hormone called aldosterone, which makes you hold on to sodium and lose potassium. The extra sodium raises your blood pressure, and the low potassium can cause muscle cramps. The good news is that GRA can often be controlled with a type of steroid medicine called glucocorticoids, which is why it is called glucocorticoid-remediable. Why does GRA happen? It is usually inherited from a parent. A tiny piece of DNA that controls the aldosterone-making gene swaps places with a piece that responds to glucocorticoids. Think of it like two recipe cards getting mixed up. The aldosterone recipe now listens to a different chef, the glucocorticoid signal. Because of this switch, the adrenal glands produce aldosterone when they should not, especially after you wake up or during stress. In most families, the change is passed down in an autosomal dominant pattern, meaning just one copy of the altered gene can cause the condition. What might you notice if you have GRA? High blood pressure that shows up early in life, sometimes in your teens or 20s. Headaches or a feeling of pressure in the head, especially after a stressful day. Muscle weakness or cramps, often in the legs because potassium levels drop. Frequent urination or feeling thirsty, as the body tries to get rid of extra sodium. If you answer yes to any of these, especially a combination of high blood pressure and low potassium, it is worth talking to a doctor about GRA. How do doctors find out if you have GRA? First, they will measure your blood pressure and check blood tests for sodium and potassium. If potassium is low, they may do a special test called the aldosterone-renin ratio. A high ratio suggests excess aldosterone. To confirm GRA, a genetic test looks for the DNA swapping we described. Treatment is usually simple: a low-dose prednisone, a glucocorticoid, taken once a day can turn off the mistaken aldosterone signal. Some people also need a potassium supplement or a medication called spironolactone to block aldosterone's effect. The goal is to bring blood pressure back to normal and keep potassium levels steady. Regular follow-up visits help adjust the dose if needed. Can you prevent GRA? Because it is a genetic condition, you cannot stop it from happening in your family. However, you can lower the risk of complications. Know your family history. If a close relative has GRA, ask your doctor about testing. Watch your blood pressure. Regular home checks help catch rises early. Eat a balanced diet with moderate salt and plenty of potassium-rich foods, bananas, oranges, spinach, to help balance electrolytes. Stay active. Exercise helps keep blood pressure in the healthy range. While you cannot change the gene, these habits keep the heart and kidneys happy. Scientists are exploring gene editing tools like CRISPR to correct the DNA swap in laboratory models, which could someday offer a cure without lifelong medication. Another exciting area is the use of long-acting glucocorticoid formulations that need only a weekly dose, making treatment easier for patients. Though these advances are still in early stages, they show promise for safer, more convenient management of GRA in the future.